Viral infections, which is caused by human herpes virus HHV, which have 4 to 5 variants. Human herpes virus, also called human simplex virus. HHV1 or HSV1 is affecting all the body parts above the waist, and HHV2 or HSV2 affects below waist. HHV3 or varicella zoster can lead to chickenpox in children or because of the herpes zoster. Then HHV4 is Epstein-Barr virus EBV. HHV5 is CMV cytomegalovirus, where we see owl's eye appearance. HHV8 is Kaposi sarcoma. HHV4 or Epstein-Barr virus can cause Burkitt's lymphoma, nasopharyngeal carcinoma, oral hairy leukopenia, and infectious mononucleosis. Now, HSV1 virus can cause herpetic eczema or desquamative allergic changes, then herpetic gladiotorum, which is seen in wrestlers, herpetic barbe, which is seen in the beard of men, and herpetic whitlow, which is commonly seen in the fingers of the dentist who doesn't use gloves. Its etiology is it is a primary lesion. It subsides in the dorsal root ganglion in the dormant form for 7 to 8 days. Then through the sensory nerve path, it causes the lesions again, which is called secondary lesion. It is kept in the trigeminal ganglion or brain. So the primary lesions are found in attached gingival area. It is also called acute herpetic gingival in children. The secondary lesions are found in vermilion border of lip, corner of lip, and labial mucosa. It is also called recurrent herpes lesion. In the histopathology, we see balloon-like vesicles, which are large degenerated spherical cells which are not attached to the surrounding epithelial cells. Zang cells are present. Lip skirts bodies are present. The stains used are Wright's stain and Ginsa stain. Herpangina A4 is caused by Coxsackie virus. It is an epidemic lesion usually occurring from June to October. The lesions are seen in posterior palate and facial pillars wherever we found loose mucosa. Varicella zoster, it is causing chickenpox in children, and herpes zoster in adults, known as shingles, zona, or Anthony's fire. The primary lesion causes chickenpox, which are centrifugal in spread and are small lesions. Herpes zoster is a recurrent infection of varicella zoster virus. It remains dormant in the geniculate ganglion. Therefore, the facial nerve is supplying that part of the face. Dermatome is affected. Therefore, it never crosses the midline. Inside mouth it causes ulceration, and outside mouth it causes itching, then tingling, and then vesicles, which are painful ulcerations. The syndrome associated is James Ramsay Hunt syndrome, which is a triad of facial nerve palsy, herpes zoster lesion, and ulceration or pathology of ear. Now, Epstein-Barr virus, which causes infectious mononucleosis or Kissing's lesion. There are 2 tests, Paul-Bunner test and monospot test. Other diseases caused by Coxsackie virus are hand, foot, and mouth disease caused by A16, acute lymphonodular pharyngitis A10, and herpangina A4. Measles is caused by rubella, and German measles is caused by rubella. In measles, we see Koplik spots in the posterior palate region, and we see a giant cell known as Warthin-Finkeldy giant cell. In German measles, there is problem in the first trimester of the pregnancy, and the lesions caused are blindness, deafness, and cardiovascular problems. Other giant cells seen in some other diseases like Reed-Sternberg's giant cell in Hodgkin's lymphoma and Tauton's giant cell in xeroderma pigmentosa. These are other 2 giant cells seen in other diseases. Tauton's in xeroderma pigmentosa and Reed-Sternberg in Hodgkin's lymphoma. Now, papilloma is caused by HPV 6 and 11. HPV 6 also causes condylomata acuminatum. Now HIV virus, HIV-1 is causing AIDS in Central Africa and HIV-2 is causing AIDS in West Africa and in India. The CD4 cells, which is a part of humoral type immunity, its normal count is 500 to 1500 cells per mm cube. Normally the CD4 is to CD8 ratio is 2 is to 1, but in HIV it becomes 0.5 is to 1. It is non-symptomatic when the CD4 count is 500 per mm cube, but the characteristic of AIDS, that is CD4 count is 200 per mm cube, it becomes symptomatic. Now Kaposi sarcoma, which is caused by HHV8, the lesion is multiple nodular exophytic lesion. There is a tumor in the vessels and bluish red lesions in palate, which are very common, but no blanching is seen.